recording. I'm going to share my screen. All right, I have to go here first. And part of this too is I I want I really would like to reclaim the term holistic, and I don't think it's happening, but we'll go over that as I share this. Um and like I say, I did this once before, but I can't remember why it won't go on to the right page. Can you see thoughts from the healer's notebook?
Now I do.
Yep.
Repair
Yes.
position. Okay, cool. Okay. So, um yeah, three paradigms of healing. So I wrote this as veterinarians as my audience, but it goes for anybody. I mean, all of us here are helping other people. We're following people on Facebook. We're trying to help our animals, and we're all healers. Everybody's a healer to some extent. Our bodies are healing themselves every single day. Our bodies are healing and repairing itself every single day. And there's actually a thing I shared on Substack. I'm going to read it because I think this is really important to remember. Um, okay. If you ever feel like your body is broken or your animal's body is broken, remember this. Am I recording? Am I recording? Let me make sure.
Yeah, you were.
Should be. Okay. If you ever feel like your body is broken, remember this. Your stomach lining renews every 3 to 5 days. Your skin replaces itself about every 4 weeks. Your red blood cells turn over every 3 to 4. Actually, it's like new red blood cells are made every 3 days. This says every 3 to 4 months. I should have checked this. Your liver regenerates roughly every 1 to 2 years. Your skeleton is largely rebuilt about every 10 years. You are not a fixed machine. You are a constantly renewing system. And this goes for our animals as well. So, what we do now, I'm going to change mine. Sorry. What we do today can affect how our body's going to be, and what we give our animals today is going to affect how our animals' body is going to be, and how well they can repair and renew and heal themselves. So I put this up here, like remembering why we chose this path. And I said, we all have an idea about what it means to be a doctor of veterinary medicine or to be an animal doctor. And for many people who went to vet school, and for many people who never went to vet school, but they had this when they were little kids, formed way back in early childhood of wanting to make their pets and heal their pets better and to doctor their animals that they loved around them. So long ago and far away, doctors, what we call doctors today, were called healers or shaman. And healers existed before the modern science of medicine. Anytime there was a group of people, and most people had animals living around them as well, they there was somebody around there who knew remedies, and a lot of times it was the actual farmer or the the person. Oh, the buddy, stop turning on and off the lights. So, or it was the mother healing her babies that had fevers or were sick with colds and flus. There were people. My grandfather broke his ankle and formed himself a splint and healed it. So, and they were often reaching for passing down remedies and methods of healing from generation to generation to generation.
Can't talk
And
right
then
now. I'm
like
doing.
the healer at the at the side, usually on the outskirts of town, or that would travel around from village to village. There were the shamans that you would go to when you had a very serious problem, usually approaching them with armfuls of offerings, because by offering things to the shaman, you were also offering things to the gods in the spirit realm, and you were showing your gratitude and appreciation beforehand, often pleading with them for help and healing, right? That's something that we've forgotten about in this day and age, especially on Facebook. So, um, this wisdom that has passed down through generations after generations after generations of ancestors remains really profoundly relevant today. And a lot of times it has been pushed to the side, saying, oh, yeah, grandma said to do this, but what does she know? She doesn't know anything at all. And we've disregarded a lot of it. Now, traditional Chinese veterinary medicine, Ayurvedic veterinary medicine, or medicine regular, were all have their roots, and all forms of herbal medicine, no matter what school of herbal medicine you practice from, all have their roots in these ancient traditions. There are stories of Gahong sitting up in the mountains of China, and literally just like the paintings of him make him look like a hunched over like ape man almost. And he was like tasting different herbs and everything to see what they did in the body. It's kind of like Hahnemann with homeopathy, who was a lot later in the 1800s, who was taking doses of these remedies to see, he would do provings of the homeopathic remedies by giving doses of the medicine to his patients and seeing what symptoms it made, that specific substance created, not only in their physical body, but their emotional body, their spiritual body, and psychological. So, it's a long tradition built up. And I also want to acknowledge, um, make a dedication to all of my teachers and their teachers that came before them, because we're not standing in isolation here, guys. In particular, I wanted to honor Susan Weed. She's kind of the grandmother of modern herbal medicine. She taught me a long time ago, before I even went to veterinary school, about these different paths of healing, and planted certain seeds within me that I still carry. And there's other many teachers that I've had too that have just given me passed large amounts of their wisdom on. And so I think we need to acknowledge that and dedicate that and realize where our roots are from, because when we talk about ancestral healing and ancestral medicine, those people, even though they may not be in the physical, they're still here to help us. Um, so the three paradigms of healing, there's the scientific medical paradigm, which is pretty much like modern medical practice, and began really the with science. I would probably say, the development of antibiotics, the development of surgeries, which began way back in the 1800s. And they would take modern medical practice would take things from traditional practices, but then all of a sudden, like the 20th century came along, and they were like, oh, but this is our system and everything else needs to be blocked out. So we have the scientific medical paradigm, and that's the one that most all of us are indoctrinated into. And I use indoctrinated very specifically because that's the one we grow up with, and that's the one that most people believe in, and that's the one. And because of that, millions and billions of people got a injection in their arm a few years ago without really even thinking about it, because that's what we were supposed to do. So then we have the heroic paradigm. The heroic paradigm is like rescuing the patient. The heroic paradigm is, you could say, it was the guru, or that magical doctor who has a cure for cancer, or the one medication that's going to cure everything, just take it for everything and it's going to cure everything. And I've seen a lot of cure-alls come around my way, and there's cure-alls even today. So that's kind of the heroic paradigm. It's like grabbing the patient um, by the back of their neck before the jaws of death are in front of them. And then there's a what I call the holistic paradigm. I could also call this the wise woman paradigm. You could also call this the traditional medicine paradigm, which is slow medicine. And it's the medicine that's rooted in the more ancient world. And it's the medicine, and we'll talk about each three of these, but it's a medicine that acknowledges the body's own healing capability. Now, these paradigms are not mutually exclusive. I use each of these paradigms every single day and sometimes jump from one to the other in the same session. There's usually one that's guiding me more than others, but sometimes you have to step in, and we'll talk about the pros and cons of each. But I think it's really good to have an underlying awareness of what paradigms where we're working from, to not get caught up and drawn down a path that isn't necessarily the best path for the patient in front of us. Um, so, I use all, and none of these paradigms are stuck with any modality. The acupuncture can be practiced from a scientific medical paradigm, it can be practiced from the heroic paradigm, and it can be practiced via the holistic paradigm. Same with the herbs. So it doesn't, none of these paradigms preclude one therapy over another either. So I just want to make that clear. But each paradigm uses certain modalities more than the others. Um, and why this matters is again, it's providing a framework and foundation for how we approach our own health and healing and our animals. And it's especially if we have like a more holistic perspective and want to develop that, if we're working, providing high touch, hands-on treatment and healing. And it's just, anytime somebody presents us with something, an herb or a new thing, just to look at it and have this kind of in the back of our heads. Now, this is something that's often forgotten, like the sacred nature of the healer's work. And this is a healing triangle that I came up with because it's not just the patient that's involved, but it's me sitting down with, when I'm in session, I'm the veterinarian and I have a pet patient there, but I have the human client, the pet parent sitting there as well in this triangular relationship. And I found this symbol because it's all heart centered. The human client loves their animals, sometimes almost in an unhealthy way in some instances, but they really truly love their animals. I, as a veterinarian, love my patients and coming to them from as heart centered of a place as I can. And there's the client and the veterinarian relationship as well. And there's different strands there running from one to the other. Buddy, can you please sit down? Yes. Just a minute. He's unplugging all my cords. Buddy, he didn't see mom all day long. Okay. Come on, come over here. Get off the cords, sweetie. Come here. Buddy, this way. There you go. Okay. Um, Now there's other triangles that you may have heard of. There's triangles, the most common triangle that psychologists talk about is called the drama triangle, and it's the rescuer, the perpetrator, and the victim. And when you're in a triangular relationship, that can easily develop within this triangle I'm showing you between the veterinarian, the client, and the patient. When you have these 3 points. but there's some people that have turned like the perpetrator rescue victim into a more empowered version of challenger. Instead of perpetrator, it's a challenger. Like, I'm challenging you to stretch yourself and reach to a different place. And then the rescuer is more the coach. So they're going to help maybe the person or animal rescue themselves instead of stepping in, and enabling poor behavior. And then the creator is instead of the victim. But all three of these things can rotate around. So this is just something to kind of think about in the back of your head. And believe me, I've had clients try to put me into the position of the perpetrator or the victim, or switch from back and forth. And so it's a good thing to have in mind if you're doing any work, and even when you're doing work yourself with a healer or a facilitator, because all types of different things can go on, projection and all kinds of different psychological things. So I'm just throwing this out there. And it is really, when we talk about healing, it is really sacred work. um and I think we need to take it from that position, you know, of having gratitude for that. So, the scientific medical paradigm. So this is essentially, it's like Western science, met what we call medicine today. The core principles are evidence-based medicine. It's based on, you know, using the scientific method of developing a hypothesis, gathering data to see whether the hypothesis is proved right or wrong. So we have diagnosis through diagnostic testing and observation. The treatment is based on scientific research, or at least it used to be. There's a big, it's been very watered down and taken over. So it should be, or is meant to be, based upon scientific research in terms of efficacy and safety of medications, treatments, all products. There should be repeatable, measurable outcomes. It focuses on the disease processes and pathology. And it looks at the body as a machine, essentially. So it breaks everything down into a biomechanical, Newtonian world. So the limitations of this, because it's a very reductionist type of philosophy, is it can literally reduce the patient to a set of data points. If you go into an oncologist and they diagnose your dog or cat with a certain type of cancer, they're going to say, well, the statistics say, and they're going to reduce that patient down to the data points that they have, that there's, well, you know, if we use this kind of chemo, there's a 30% chance of survival. And, you know, this gives a 60% chance of survival. And if you don't do anything, your animal's going to die. But if you do all this stuff, your animal's also going to die eventually. They just don't mention that. So, so they may overlook, it's more like looking at the statistics and averaging over time. So they overlook the individual's unique response and the individual's possible side effects of the treatments. And sometimes now they're overlooking the side effects altogether and blaming side effects on other things, which is what they're doing with Librela. So they focus actually on disease rather than wellness. You don't go see a doctor until you have disease, or if you go into the doctor, they're searching, sometimes microscopically, to find some element of disease there so that they can prescribe you something or do some treatment on you or do surgery or something like that. So it's all, disease is like the name of the game. It can create distance between the healer and patient, which sometimes is a good thing. If you have to go in and do surgery on an animal, you have to get yourself into a different frame of mind. And, you know, while you're sitting there putting the animal under anesthesia and cutting their abdomen open, you can't be worrying about mom out in the waiting room, or the little girl whose dog that is, what's going on with them, because your mind won't be focused. So sometimes they actually, part of the training going through veterinary school and medical school is creating that distance, but they do it in very kind of unconscious ways in a way. I mean, just putting on a doctor's coat is a way to create that distance. Like saying, I'm the doctor, you're the patient or the client, and there's a difference there and a boundary there. Um, and it's really, unless you do that, you don't realize the power of that. I was When I was in veterinary school, I wore a blue doctor's coat as a student. All the students were in blue doctor's coats, and the veterinarians were in white doctor's coats. So our teachers, the residents, um, people who'd already graduated from veterinary school. When at the end of the year, they actually hired me, the veterinary school hospital hired me on to be a clinician for their general practice rotation. So in 1 week, I was wearing a blue doctor's coat, and then I showed up for work a week later, right after graduation, and I put on a white doctor's coat, which was really it was really freaky, but it showed me that, like, wow, okay, now I'm standing in here in a white coat, but along with that is always, it carries a lot of responsibility. So there's a very Saturnian heaviness to just changing the color of that coat, to where all of a sudden people were going to be coming to me for answers. It's a very different situation. Um, it's very limited. This paradigm is very limited to specific accepted protocols. The hospital may make up their own protocols for diseases or their own treatments, and this is how we treat this. This is how we treat that, regardless of what the actual patient is showing you. So there are strengths. It creates concrete, testable interventions. It advances scientific knowledge. It's how they do studies to find out what works and doesn't in terms of their medications. It gives us really powerful tools for acute illness and injury. If you have a broken leg or a compound fracture, or your dog's in a cardiac crisis or respiratory crisis, you want these things. You want the Lasix to pull the fluid off the lungs. You want the IV fluids to keep the animal from dying from hypovolemic shock. You want a blood transfusion if you need it. You want them to be able to repair that broken bone. So that's where it shines in emergency medicine and acute illness. And it creates standards of care which have their positives and negatives. So, and then I just talk about it in-house call practice versus otherwise. So I think we all know about that. There are, all of these have pros and cons. So the heroic paradigm, and this is what I see a lot in alternative medicine, I see a lot on Facebook, I see a lot in the integrative cancer thing right now, because that's becoming, well, it's really interesting. So I'll go over the heroic and we can talk about the integrative cancer therapy issues. So the core principle of this is kind of their mantra of the heroic paradigm: purify the body, control the mind, and clear the spirit. And we've all talked about, I think everybody can relate with this. So you purify the body by detoxing the body, and all the environment is just full of poison, and we've just got to clear the toxins. And we control our mind by meditating, but that's not really why we do meditation. We do meditation to get to know our mind, not control it. And clearing the spirit. So, like smudging and going through spiritual cleanses and doing exorcisms and cord cutting and all of these types of things. Okay. The healer is seen as a savior, and the healer is the reason for the return to health. So if the animal has some miraculous, like survives or comes out of a crisis situation, then it is looked at as the healer's good work. Then of course, if the animal dies, then the healer can be quickly knocked off the pedestal. And I had people say this, I had somebody say this to me last week, like, well, you saved their life. You gave me more years with my dog. She can walk. And I said, I did not save your dog's life. I helped your dog heal from the condition it was in. And I gave support, and you gave support, and the dog decided to stay around for a while longer. Okay. Um, in this paradigm, it's kind of like they have really strict rules and again, really strict protocols. So you have to follow the rules or kind of suffer the consequences of the rules. So it's like if you follow all of these rules, your dog is going to live forever. And that's just not true. But, there's that hope. The heroic paradigm really pulls into locking into people's hope and people's fear of death and dying and people's fear of losing their animal. So it's like, if you follow my whole program, then everything's going to be okay. Um, they use pretty powerful remedies for powerful diseases. So one of the, like in terms of herbal medicine, they may use things like, back in the day it was like cayenne pepper and valerian and really strong potent herbs. Or it's the concept of like, well, if this dose of herb isn't doing it, then double it, triple it, quadruple it, or add in three other herbal formulas to the animal. So it's kind of like more is better in some instances. They focus on longevity. Again, the right diet, herbs, and exercise will keep them young forever. And it's really hard to see this because it's a denial of death. And people, my whole thing is, I think we should try to live as healthy, thriving lives as we possibly can while we can, because none of us know how long we have, and none of us know how long our animals have. And so, I don't make promises. I never have, even when I was in veterinary school, to anybody. It also can pull on almost toxic religious feelings. And I listened to a really good podcast a woman put up, and it was exactly about this of like, somebody goes in and say their dog has cancer, and it's like, but I've been trying everything, and I've done this and I've done that, and they've been on the best foods, and they feel like it's their fault the animal's sick. And so the person will play on that blame and guilt and get them to sign up for their huge expensive, preventative program or whatever it may be. And so there's also this punishment forgiveness, which kind of goes back to our Judeo-Christian roots, but that can be a whole nother rabbit hole to jump down as well. So often aggressive treatment protocols are used, and they're kind of used across the board versus being individualized treatment protocols. There's a lot of cleanses, and this goes all the way back into the 70s and with alternative medicine, but we see it all the time on Facebook. Oh, we got to do the liver cleanse, like put them on milk thistle every day for the rest of their life, and everything's going to be good. Detoxifying, which you don't really detoxify the liver, can support the liver. Fasting, the sauna movement, the cold plunge movement. Now, all of these modalities, they may be good and they may be helpful, but it's just they go to extremes and sometimes put the body through some pretty severe testing. Even like ayahuasca ceremonies, when you're out there puking your guts out or stuff's, running out both ends, it's okay, that may be a detox, but it's pretty harsh on the body as well. A lot of rectal treatments are involved with this. And this goes all the way back to like the enema thing. It was like in the early 20th century. And then colonics, cleaning the gut out. And that doesn't mean that, yeah, sometimes people can have a lot of impacted shit in there. Um, and now instead of colonics, we're onto ozone and fecal ozone treatments for like everything. And fecal transplants, which is not to say that that stuff doesn't work, but it's just kind of and I didn't realize this until I really sat down and redid this talk, is there's this whole thing of purging the toxins and the dirt and the filth out of the body. as if the body couldn't do that on its own, which we do live in a toxic world, and that is one part of it. But I'm just saying to be aware of, not getting stuck in this and this alone. So in this paradigm, the veterinarian or the healer is actually the active agent of change, and the patient is just the passive recipient. And I will say one thing here, like there's a whole integrative cancer movement going on, and it's not what Kendra Pope or like true integrative oncologists are talking about, but there's a whole thing where they've got, you do these four modalities: ozone treatments, fecal transplant, vitamin C therapy, and mistletoe, and you're just going to cure every cancer that's out there. And that just a lot of them are helped by that, but then there's a certain point where they aren't, and there's some that will never will be. Okay, so that's just one example of this going on. And I know some people get really wrapped up. I've seen veterinarians get really wrapped up emotionally on I've got to be the hero. I see the veterinarian chat boxes on this, and I feel bad because these people are just like, but they're not responding, and I'm doing this and this and this, and they're like really emotionally wrapped up in the case. Instead of stepping back, and we'll look at the last paradigm we're going to talk about. So the shadow side of the heroic paradigm is, you can actually create a codependent relationship between the healer and the client. And I've had these. I've been in the middle of them before. And it's definitely not fun because you get a lot of energy pulled out of you, and it can be a really big drain. And it's not really helping the animal either. Um, we may ignore the body's own healing capacity. So it's kind of like the patient is there, but they're not really being listened to or attended to in certain ways. It can be expensive and invasive, some of these long protocols. Sometimes it prioritizes really dramatic intervention over gentle support, and there's the risk of doing something. We have to do something when actually just stepping back and watchful waiting might serve the patient better and might serve everybody a little bit better. And then, of course, like the denial of death as part of the healing path of life. I have witnessed, I've been around a lot of death around my whole life, from when I was a little all the way through. And I have witnessed amazing healing opportunities that have happened around the dying of a person and an animal. I mean, I have seen people go back and heal relationships with their siblings, with their parents, with their partners or husbands and wives. All different kinds of things take place if the space is opened up and it's allowed. So, um, I don't see death as, sometimes here it's almost like death is, well, we lost the game, we lost the fight. And I don't feel that's true at all. Um, and I feel like it places, and that's where the guilt comes in. It places an absolutely unjust amount of guilt on both the client and the veterinarian or the healer, by doing that, because it's not about either one of them. It's about the patient. It's about the animal. So in house call practice, I mean, sometimes we need to be healers. Sometimes we need to rush an animal for emergency care. We need to intervene with stronger treatments and modalities just to kickstart things and to maybe like remove a layer of toxins and stuff. But we have to be really mindful of when we're acting from ego, like I can fix this because I went and learned this new modality, and this new modality is just the trick. It's going to turn everything around. And honestly, you guys, I rarely see that happen after 25 years, 30 years of practice in all different kinds of modalities and situations. The only time I've seen, well, versus when we're serving the patient and placing their needs first. The times when I've seen like true miracles happen in healing, like people coming out of like severe cancer when they were given death sentences, is within they themselves open, like something shifted within them. So, because they were giving a certain space to allow that to happen and to see that as a possibility. So, so the wise woman holistic paradigm, this is like the slow medicine. Susan Weed described this as the grandmother who just took care of all her children and grandchildren. And when you're in bed with the flu and she comes in with that hot chicken noodle soup, but it's made with chicken bone broth, and wraps you up in blankets and puts a cold cloth on your forehead to help with your fever and sits and rocks you in her rocking chair, that's like slow medicine. Um, Ancient, there are a lot of acupuncturists that are coming back to the slow medicine. Liz isn't, I don't believe she's here tonight, but she and I have been talking a lot about that. So it's rather support rather than force. It's holding that patient, that animal, wherever they are, and not expecting them to be any place else than where they are. And when you can do that, there's a partnership opens up with the patient's own healing capacity. Sometimes they don't have any healing capacity. Some animals I've come across and I'm like, oh man, they're halfway to the other side right now. And yet, by just opening up the field and again giving them the possibility and the choice, sometimes they'll rally. And I'm like, wow, I know. So it's not really learned over the years, it's not about me, it's not about what I want, it's not about what the client wants, it's where that patient's at, where their chi is at, and what their path, their soul path is out. So it's nourishment. With nourishment comes over intervention. So nourishing the body, whether that's nourishing the body, giving it food, nourishing the body with red light therapy can be used to nourish the body, nourishing the body with acupuncture, just gentle massage, Reiki, sending that heart energy to them. All of that is nourishment. And it's looking at the whole being rather than isolated symptoms. So a symptom is more of just like a calling out, showing where the imbalance is happening in the body, versus where the dis-ease is at, and that's where things may need to be readjusted. And it requires a big trust in the body's wisdom, understanding that the body is here, is the body can heal itself. The body is what does the healing. We can support it with different things and give it energy and support, but the body is what actually heals. And the healer is acting more as a witness and guide and facilitator than anything. So you're also listening and respecting the animal's needs and wishes. I mean, I will never forget my very first job at a veterinary clinic. It was a conventional clinic. I'd only been out of school for like a year. And this orange tabby came in. I think he was about 13 years old with huge enlarged lymph nodes, and he wasn't my case. He was diagnosed with lymphoma, and I believe he even had feline leukemia. And the owner was a young girl. She was out living on her own down here in Florida by herself. And she really, really loved that cat. It was like her heart cat. And the vet I worked for said, well, we've got it. We have to do chemotherapy. And they brought that cat in, and I think it was the second chemo treatment. And the techs had the cat in the treatment room on the back table trying to get a catheter placed to give the chemotherapy. And I walked by the table and I just got a blast from that cat. It was like, I do not want this. And he was fighting them so hard. And I made them stop right then and there. I said, listen, just stop. Just put the cat back in its cage. Just take a breath. I'm going to call the owner and talk to the owner. So I went and called her and I told him what the cat had told me essentially and what was going on. And she's like, oh my gosh, I don't want him to suffer like that. And I don't want something forced on him at all, if that's what it looks like. She said the other vet said it was going to be an easier procedure and everything else. And I said, well, this is what's going on. And at the age of your cat and everything else, there's not, we can try some other things instead. And so we stopped it. But that's just listening and respecting the animal's needs and wishes. Um, and so many people get on this, well, we've got to do this. It doesn't matter whether it's chemo, whether it's radiation, whether it's this treatment or that treatment or this treatment. I mean, I pulled some animals off of, like, if an animal doesn't want acupuncture needles, I don't give them acupuncture needles. I'll try something different. Um, so the characteristics for the holistic paradigm, it's gentle supportive remedies, a lot of tonics, a lot of things that I've taught over the years in this course and elsewhere. Nutrition and lifestyle as a meditation, time and patience, just stepping back a little bit and listening deeply to what the body's saying and honoring the healing journey and not just the destination, like not just whether they're going to live or die, but what's really going on with that animal. And recognizing that sometimes healing doesn't mean curing either. Um, so tools used in this paradigm, like whole food nutrition, we're looking at whole herbal medicine, using the whole plant spirit medicine. Like sometimes I might prescribe an herb to an animal, but it's not necessarily the qualities of that herb, and what that herb is meant for may not be why I'm using that herb. It's because as I'm talking to them, that herb shows up, like comes into my mind and was like, I can help with this. And it's really interesting. And then sometimes I go and I'll look at the different qualities and be like, wow, I didn't even know it did this, but yeah, this is a really good herb for this scenario. So that's what I do even on my telephone consults. A lot of times herbs will pop in. I just did a journey the other day and an herb popped in that I had to go gather for winter and the new world that we're birthing right now. And I may put that up too. It's winter aconite, which actually happens to be like a part of the buttercup family. So anyway, so herbs will come in as plant spirit medicine, energy work, doing Reiki, and just allowing, saying, okay, here's some energy. You can do with it what you want, however you need to use it. Environmental modification, if making them warm and comfortable, or taking them places that they like to go to. um, Opening up the field to the presence healing and quantum healing, and really quality of life focus. If we're talking, hospice and palliative care, that has also taken a really strange turn as of late, which I'm just now discovering. And they are putting animals on tons and tons of opiates and drugs and just zombifying them, which is what they're doing to people. But I don't think that's appropriate for hospice and palliative care. But there is death nesting, and there's a wonderful book called Death Nesting. Um, being being present for your animal and being present for the whole situation, because it's usually a whole household, and there can be family members or there can be one single human living with the animals, but those animals are there to teach them something. And I think Norma can agree with me on this. It's like they are there to bring so many lessons to us. And so by opening that field and being present, those things can come through, and you can be there so that the client actually is able to hear a lot of that. And then looking at species specific needs, we have anthropomorphized dogs and cats to such an outrageous degree. And listen, I don't believe I would be seeing this, but there's got to be a middle way for everything. We have anthropomorphized them to where we have forgotten that they're dogs or forgotten that they're cats. And those two species have lived very different lives when they're living out in the wild on their own. And it's really important to understand the natural history of the animal we're working with. You know, dogs, they're social animals. Cats are not. They can live in groups of females, but they're very different and they require different needs. Like dogs are very oral and like to chew on things, and they need to be provided with different opportunities. So the art of presence in this paradigm, sometimes our greatest gift is just simply being there and holding the space, bearing witness to the suffering, to the transition, to that profound bond between human and animal. And our presence itself actually becomes the medicine. Um, And so where this serves a lot, I mean, I pretty much the longer I'm in practice and the more experience I have and the crazier the world gets, I just pretty much stay in this paradigm as much as I possibly can anymore. And so then I attract people who are also looking for this as well. And if they want the other, there's plenty of people that can provide them with the other. So this paradigm serves very well in all kind of chronic health conditions and end of life care, and also in prevention and wellness. If we set that animal up as a puppy or kitten in their new home and with the opportunities they need and socialization and everything, they can have a really healthy life and sometimes never have to turn to the scientific medicine. My 15-year-old husky, the years I had her, she went in 3 times to a clinic, once for x-rays, once for a mass removal, and once because she had a really bad corneal burn. But that was it. Um, it also serves when the scientific paradigm has reached its limit. And unfortunately, that's a lot of the times when I get the animals. When they've gone through the chemo and radiation, but they want that one last chance of finding something that might help. And it's like, well, I wish you would have come to me like before, but let's see what the animal wants right now. When the animal is telling us they need gentleness, it's like that cat that was about ready to receive chemo. Um, or that animal, I've had a couple animals just in the past couple weeks. They clamp down their mouth and they will not take anything. They don't, I've had them refuse all kinds of herbs. I've had them refuse liquids. I've had them refuse food. And it's like, listen, what are you going to struggle with them when they're already, when clearly they're like, I'm done. That's just it. I'm done. And when the client needs support as much as the patient needs treatment, which is often the case, I think people need permission to call it quits if they need to. They also need support in reading the signs of their animal and being present for them. So that's all of that. And I'll put this up as a PDF. I put together this, and this is just interesting to read through and go through these things. Um, we have like the symbol associated with each one, like scientific is a straight line from point A to point B. The heroic is a closed circle. And the traditional or holistic method is more of a spiral. Like we may get really, really bad, but we may circle around to where spirit is freed up or other things can be freed up. And then the starting point, illness, disease, or wholeness, the worldview, how they view disease or death. So scientific, that's the enemy we're fighting against. In heroic, it's the results of toxins. In the traditional view, it's disease and death can be looked at as transformational allies, believe it or not. And then if you can do that, things can be really turned around. Mode of operation, view of the body. So you can look through all this. I also put down like the troubled one says in the scientific view, it's beyond me, just fix it. Like, here's my animal. They'll almost throw the animal at you. I had somebody do that up at the Chi University. It's like, my dog is limping on its leg and you're going to fix it. And he handed me the leash. I'm like, whoa, whoa, whoa. I am not the right person to be working with your dog if that's what you want. In the heroic tradition, there's like, oh, I'm sick, I must have done something wrong, or my cat's sick, I must have done something wrong, so punish me for that, or make me go through fast, or make me go on a restricted diet or something like that. In the traditional world, it's more, I seek support so I can go to my depths, so I can go maybe into the source of this disease internally. So it's a very different way of looking at things. And then the healer in the scientific paradigm says, trust the test results. And I think we've all heard this. Well, the blood results say this, so this is what we're going to look at. And you're like, but my animal is doing this, you know? Then the healer says, in the heroic tradition, I'll save you. The doctor will be like, oh, there's nothing to worry about. I'll save you. Which we all want to hear, but it may not be the honest truth. And then in the traditional version, the healer says, I'll play with you in this sacred garden. So I'll hold your hand this journey that you're going through. So anyways, you guys, I'm going to put this up as a PDF so that you can print it out or save it to your computer if you want. And like herbal medicine and the scientific, there'll be a lot of, I will use alkaloids. They'll use the isolates from herbs. So like take the salicylic acid and make that into aspirin out of the willow bark, or take the foxglove and extract digitalis from it, or take the marijuana plant and extract CBD from it. So they're always looking for that active constituent in the plant. Whereas a heroic tradition, they'll use it as medicinal strong to stop the symptoms, using it symptomatically almost as a pharmaceutical. And then in the traditional, it's more like using common weeds and tonics and making infusions and drinking teas and using herbs as food, like putting the dandelion greens mixed in with their food. That would be a really good example of it. Or using like hawthorn berries for the heart, but and then the like nettle tea infusion for your minerals and everything else. And then there's also a power distribution, like in scientific, the client hands over power to the doctor. In the heroic, it places the healer on a pedestal as a guru, as a savior. And then in the traditional, it's going within for answers or letting the answers be revealed, right? And I also put lineage down here, like the scientific comes out of Newtonian physics and Descartes, and the heroic tradition comes out of like Hippocrates, really, where he said medicine is food, but there's also Galen, where they were like more, a little bit more harsh, like we'll, push this out of the body or pull this into the body. And then the traditional comes from more the shaman or the crone or the medicine woman. So there we go. I say thank you, and the animals thank you as well for listening and being present to them. Guys, it's one of the most important things we can do. I'm going to stop the recording.